Hello, everyone. Welcome to today's webinar. My name is Chad Severs, and I'm the project manager for Arkansas Building Effective Services for Trauma, and we're glad you joined us today. I'm going to tell you a little bit about us and our speaker and do some housekeeping announcements, and then we'll get started. ARBEST is a state-funded program at the UAMS Psychiatric Research Institute, and our aim is to improve mental health services for children who have experienced trauma from events such as abuse, natural disasters, or family separation. We work closely with child advocacy centers and other providers in the state to build trauma-informed mental health system. And we're probably best known for providing training to mental health professionals and treatments that are effective in helping children recover from trauma. And so our goal through this training, in addition to the direct services and technical support and outreach in the community, that we're really transforming the delivery of mental health services here in Arkansas. So again, welcome to today's webinar, Therapeutic and Ethical Considerations of Termination with Kelly Hammond. Really glad and pleased that Kelly is part of our team. Kelly is a child parent psychotherapy trainer. And if you've gone through one of our TFCBT calls, she also helps and facilitates those calls as well. So we're really glad that Kelly's with us to talk more about this topic. And a couple of housekeeping announcements. We really encourage you all to ask questions during the presentation, and you can use the question feature, which is on the right side of your screen, and we'll address those when they come up. And if you're interested in earning a CEU, be sure to stick around to the very end. We'll have a code that's given, and you'll need to enter that into a survey, and I'll have more instructions for you when we get to that point, but just stick around to the end if you're interested in a CEU. And we'll upload this webinar to our YouTube channel. If you happen to be watching this now on our YouTube channel at a later date, we only award CEs for attending live webinars. And lastly, if this is a topic that interests you, or if you're just interested in trauma and what's happening here in our state, be sure to like us on Facebook, or you can subscribe to our newsletter. So anyways, that's a little bit about us. And I'm going to turn the webinar over to Kelly.
Thank you, Chad. Hi, everyone. I'm so glad that you're joining us today to talk about a topic that can be pretty evocative and can inspire a lot of avoidance in families and kids and us as clinicians. And also it can be a time of wonderful repair and learning and growth for everyone involved. So I'm really glad that you're here, and I'm really excited to talk about this topic. So, Chad, I'm having trouble advancing the slide. All right. So today we're going to talk about goodbyes. It's really hard to say goodbyes, especially if you sort of don't know when or how to do it. And so termination for a lot of the families that we work with is really sort of that first chance at having a good goodbye. And so this can be really reparative. So we're going to talk about how to know when it's time to terminate, how we would prepare, and then also some ways to say goodbye that can be healing and sort of provide closure for families and kiddos as well as for ourselves. And so within that, we're also going to take a look at the social work code of ethics and sort of how it lays out the way that social workers in particular are called to provide termination in line with those social work values. So termination. So when we think about the end of the therapeutic relationship, there are, in fact, some guidelines around that to make sure that we have a healthy termination, as well as to make sure that we really sort of stick to those ethical codes. For the purposes of today, we are going to focus on the NASW Code of Ethics for social workers. If you're not a social worker, I would strongly encourage you to take a look at your ethical code and sort of see how it lays out the items in regard to terminating with your clients. I think it's really important that we sort of keep those things in mind. Regardless of your education or your licensure, termination is the end of the mental health professionals and the client's relationship. Within all disciplines, universally, we know that therapeutic relationships come to an end. A lot of clients and a lot of us don't adapt very well to change. So that relationship that our clients and our families have with us may really play an important role in their efforts for change. And so it's really important for us to provide a time to process the end of these relationships, to sort of reflect on the work that's been done, to really point out client and family progress, and also just to sort of spend time with how folks feel about ending therapy and ending that relationship. There are tasks that are identified through the process of termination, and that's sort of to help make sure, that we're maintaining good ethics, as well as that it's a really sort of healthy way of saying goodbye. So termination, I love this quote. Termination is a time to evaluate the work you've accomplished, celebrate the progress, talk about which goals weren't reached, and explore any disappointments with the process. It's reminiscing, an exit interview, and saying goodbye wrapped up in one. Sometimes this overview helps it all come together as seeing the work in the rearview mirror lends perspective. We don't have enough good endings in life. The nature of therapy and strength of relationship should provide clients with this one final gift, a corrective emotional experience regarding endings. So, there we go. Although saying goodbye and termination can really be anxiety-provoking and even sad to us and to our clients and their families, research really shows that most clients appreciate the chance to talk about the end of the relationship with their therapist. They really want to be able to do that. And so even though stopping therapy can, at least initially, be perceived as a bad thing, it can also be an opportunity for growth for the kids that we work with, the caregivers we work with, as well as for us. And this can be particularly true for clients who've experienced traumatic loss. Something that we really kind of have to be aware of as therapists is that we are more likely to consider termination important in those cases that we think are successful. When we terminate cases that we think are more successful, we tend to have more of a likelihood to express our own reactions about that termination. What we might not hold on to very well sometimes is that it's equally important to provide that process of a healthy termination at the end of those therapeutic relationships, even when we may not consider them to have been quite so successful. So we really need to do good check-ins and consultation to make sure, that we are providing that opportunity even in those more challenging cases. So in thinking about the end of therapeutic services, it can really be helpful to sort of think about tasks associated with termination to make sure it's successful and a healing experience. So in some cases, for instance, cases of like medical social work, we kind of know a predetermined end of that relationship. In other cases, such as relationships we tend to have, these more therapeutic relationships, the end is really more determined when the intervention that we're providing, when we have sort of met those goals and objectives that we co-created with our families. And so it can be a little bit more challenging to do the first task of termination, which is deciding when. And so the first thing we have to really consider is when is it time? When is it time to end that professional therapeutic relationship? One of the ways that we can do this is with the second task, which is the evaluation of those goals and objectives and their achievement. And we do that with the client and with their caregivers. So termination can occur if or when the desired progress is made, or when further progress is no longer possible. So in other words, services being provided should end when they're no longer needed or when they're no longer serving the client's interest. And this is actually the Social Work Ethical Standard 1.17a. And it says that we are ethically obligated to terminate therapeutic relationships when those relationships are no longer needed or serve the client's need or interest. And so the code really challenges us as social workers, and I would assume it's not very different across the disciplines, to really evaluate sort of on an ongoing basis the treatment or the intervention that we're providing. We do not continue to provide services that are no longer helpful or useful, nor do we abandon our clients. And so it really challenges us to take a look at what we're doing in the context of our cases. In some cases, the clinician may need to really sort of help summarize clients' accomplishments in order to recognize the progress that's really been made. And we'll talk about that a little bit more. In some cases, the clinician may need to have conversations with the client or with the family that, at this point, really no further progress is being made. And so, services are really no longer in that client's interest. So something I would challenge us all to do on a continual basis is really seek consultation about the appropriateness of ending therapy. Sometimes I think we hold on to clients longer than is really needed. I think that's probably particularly true with cases we enjoy. Sometimes we may feel urgency or a push to end cases for various reasons. And so I think it's important to really use your support system and seek consultation anytime we're looking at termination of services. So this is really a consideration of deciding when to begin the termination process, and it's also a task of termination. Another task is maintenance. It's important that the progress that people make throughout the intervention that we provide is maintained and continued. So as a therapist, we really want to discuss with clients and their families plans for how they're going to keep that progress going, as well as to continue to grow from the skills that they've learned in their time with you. So what this might look like is a plan for how to continue relaxation practices. It might be how for caregivers to continue behavior management strategies, or maybe safety plans that they have discussed with you. It could be plans to meet with the school at the beginning of the semester to discuss IEPs. So it can really look like a lot of different things, but it's to sort of scaffold and support kids and families to maintain and continue progress after their time with you is over. We also want to elicit reactions from their clients and from caregivers about how they're feeling. And so one of the things about that process is to really check in with ourselves about our experience of goodbye as well. And these experiences for us and for the families with whom we work can really have a really broad range. And so it's important to provide a safe place to recognize and discuss and, if possible, resolve those negative affective emotions that can be brought up by goodbyes. And this can really have a growth promoting and healing impact on clients and their families. And it can also be preparation for future losses and a way to sort of say goodbye, particularly for some kids, in which an adult doesn't just simply disappear. And so this can really set a stage for future losses that will inevitably happen throughout the course of a lifetime. And so it can help sort of show kids that goodbyes, while they're difficult and any end of a relationship is hard, there are good parts that you can keep, and that these are things that will continue on without the physical presence of that person. And in this case, it would be us. And then finally, a task of termination is making appropriate referrals. So if at the time of termination it's decided that further services are needed, we are challenged as therapists to make sure that the appropriate information is given about those referrals, and even make those referrals if that's appropriate as well. And this is also actually found in the social work ethical code, that it states that we're ethically held to take reasonable steps to avoid abandoning our clients who still need services. So we might find this especially in cases when termination is on the part of the clinician who's no longer going to fulfill the role that they have been in for various reasons. So it could be a transfer to a different clinic. It could be, you're leaving your current position. It could be a leave of absence, sort of whatever's happening. It's really on us to ensure that we make those referrals in as smooth a transition as possible. We're also challenged to really give careful consideration to all of those factors in a situation, and to minimize as much as possible any adverse effects that could result from a hasty termination. So this might mean that in cases where services are still needed, we would make arrangements for the continuation of services through a referral to someone else in our agency, maybe outside of our agency. It might mean that, if a family is moving out of our catchment area, we're trying to connect them with a provider who hopefully is also trained in the EBT we've been using with the family. And so it really is an important part of termination, and it is within ethical codes to ensure that services that are needed are able to be accessed as much as possible. Sort of thinking about that too, and the ethics around termination, particularly when it's us as the professional who are, facilitating some sort of a change when clients still need services. We are obligated to inform our clients promptly of any realistic anticipation in a disruption of their services. And so that, I think, is an important distinction of, we may not have confirmation of a change that's going to happen, but if we have a realistic anticipation, it really is most ethical to let them know a change might be coming. And so that's to sort of help prepare them. It's also to help them decide what they want to do in terms of transfer or refer to another place or stop services altogether. And then to really sort of discuss with them and inform them of benefits and risks to whatever option that they choose. And so with that, within the ethical code, it does also sort of lay groundwork for other times to consider termination and how to appropriately address it. So for instance, say in situations in which like termination is happening as the result of failure to payment, which can really kind of be an uncomfortable conversation for us as professionals to have. The ethical code does really sort of lay out guidelines for that for us. And so as long as clients are aware of that possibility that termination could happen for non-payment, termination is within that guideline. However, as discussed before, we are challenged as the mental health professional to really give careful consideration to all those factors in the situation to help minimize as much as possible any adverse effects that would result from that termination. So if you have, reasonable certainty that the client's not a danger to themselves or others, you would be within the ethical standards for discharge at that time. You are, though, however, obligated to discuss with your clients or their caregivers any clinical or other sort of consequences that non-payment and thus termination might result in. So, For instance, this could be in situations in which perhaps caregivers are in a custody battle, and if the caregiver who's bringing a child to you for treatment is not, paying for the services, and you will need to terminate, you really need to have that discussion with them of there could be like legal or custodial consequences to that. And then finally, hopefully this is not news to the audience that we have on this call. Guys, it's never ethical to end a therapeutic relationship for the purpose of pursuing a romantic, a sexual, a social, or a financial relationship with the client or their caregiver. So there's lots of reasons for this, obviously, one of which is even after perhaps an appropriate termination of services, we really have to consider the role we've played in people's lives and consider sort of protection for clients in terms of an ongoing differential of power. And so we have to hold that in mind. And I think this is especially something that is salient for folks who are out there providing therapy in rural communities. Often dual relationships are inevitable. It's really hard to avoid them. The code does give us some guidelines about that. I think the thing that stands out for me is that we do not end relationships in professional relationships for the purpose of pursuing personal relationships. So although some of those dual relationships are unavoidable, we don't end therapy sort of in order to like do what we kind of just want to do or to make ourselves comfortable. So really, I defer to and encourage you to look at your ethical code and the standards about dual relationships. I think it's really important in terms of the protection for ourselves and for our clients. So there are different kinds of terminations. The first one we're going to talk about is unplanned terminations, and unfortunately they're really common, and there can be a few reasons for this. So one reason could be a misunderstanding between the client and the therapist, and this can look a lot of different ways. Sometimes it's poor fit for personalities. Sometimes it's just not great communication. Sometimes it's a disagreement on how to proceed. And so we do see that it happens that, families may drop out prematurely because of those misunderstandings. Also, we may see an inaccurate definition of the problem. Everyone comes into a therapy room with their own perspectives and their own histories. And so sometimes the way that we define a problem may be very different from how a family or a kiddo might define the problem, and it can lead to a misunderstanding between the client, the therapist, or the family. And so that may also sort of result in an unplanned termination. We may also see that the wrong problem is selected. I see this a lot in cases where families bring kiddos in because of a lot of dysregulated behavior, a lot of acting out. And so they really want to focus on behavioral management. And, as we proceed through assessment and engagement, we see that there's a lot of trauma for a kiddo. And so we may really pursue trauma and not really tackle the behavioral issues a lot. And really caregivers are, not feeling heard and not feeling like their needs are being met. And so we may see, unplanned termination result from that as well. We may see that goals are not attainable. And, it may be coming from us as the clinician that we're setting goals that are just, not going to be met. And as we co-create goals and objectives with clients and families, it might be that they're setting goals and objectives for themselves that are just really sort of not going to be achieved. And so we have to make sure that the things that we identify in care plans and the direction that we're heading is one that is reasonable and achievable. And something that comes to mind when I think about that is a case that I had in which I was really getting frustrated with a caregiver who was not doing their therapy homework. And I, very arrogantly wanted to have a conversation about what change this caregiver thought would be made if they didn't do what I told them to do. And I had to really get some consultation and think about what was going on. And in fact, basic needs for this caregiver and this kiddo were not being met. They needed food, and they needed stable housing, and they needed utilities. And so, you know, the idea that they weren't doing their therapy homework was pretty reasonable when I had all of the information. And so I was setting goals for this family that were not attainable based on the needs that they had in the moment. Also, we may see that a wrong intervention is given. Through ARBEST, we really encourage evidence-based practices. And within that, sometimes those EBTs may not be a good fit for a specific family or for a specific problem. And so sometimes, even though we're picking evidence-based treatments, we may not pick the right one. And so we may see early dropout as a result of that as well, because families are not seeing the progress that they want to see. It could be, as we've already talked about, a change in provider. They just don't want to go to anybody else. It might be that the areas that we're really trying to address are too sensitive. And so this could be an issue of readiness. And then also, dropout can be a way for families to control the ending. As we've already talked about, endings are painful. And so one way to avoid that pain is to control the ending and just not go back. And so we may see early dropout because of that too. So the other kind of termination we tend to see are planned terminations. We consider a termination to be planned when the ending is discussed from the very beginning. Whenever possible, termination is planned with your client. The client and the family are reminded of the ending point throughout the course of treatment, particularly as we're getting closer to it, and it's processed thoroughly. And the way that we know that termination is discussed and processed thoroughly is by completing those tasks of termination that we've already talked about. So we've sort of covered what a planned versus an unplanned termination might look like. So we're going to talk and spend a little bit of time on how do we plan them. And it's a little bit of information you've already seen, because it does have to do with this tasks of termination. So again, we address termination early. We address it from the very beginning. We tell clients and families that a therapeutic relationship is temporary. And there are a lot of reasons for this. One of the, I think, most important reasons is when we tell families that therapeutic relationships are temporary, that there will be a time when they no longer need to come in for services. When we do that from the very beginning, we are sending the message that we have hope and faith in their ability to heal and recover and move forward. And that is one of the, I think, most important things that we can do for kids and their families, is that instilling hope. And so when we let them know, you're going to do this and you're not going to have to be in therapy for the rest of your life, we're really sort of expressing to them our confidence in their resiliency. So when we're planning terminations, we're also going to remind families that the termination is approaching. And so again, this is sprinkled in throughout whatever intervention we provide and becomes more of a point of interest sort of as the time for goodbye approaches. So clients are never surprised by saying goodbye. It's never something, if it can at all be avoided, that we would ever spring on a client or a family. Okay. We're also going to, in the course of planning a termination, recognize our clients' accomplishments. And this is for a few reasons. One is to reassure them and congratulate them on the work they've done. It's also to sort of illustrate that services are no longer necessary. So again, you know, we kind of have to be careful of those unspoken messages. So by ending therapy, we're also sending the message, you know, again, that we have faith in them. And then if you think about those cases, and I'm sure we all have had a few, that sort of drag on, and we kind of know it's time to discharge them. And every time we bring it up, you know, it's a difficult discussion to have for us or for the families, and so they kind of go on and on and on. One of the messages we have to consider that we might be sending is that we don't believe they can do it on their own. And so we have to think about what message not ending therapy when it's appropriate also sends. And so, of course, if it's appropriate to continue services, we should continue to do that to avoid, you know, an ethical dilemma of abandoning our clients. And, you know, we have to be thoughtful about sort of what's happening and when it might be appropriate to go ahead and terminate. We're also going to plan a termination by discussing a plan to maintain the progress that's made. And again, this is something we do from the beginning. So it's identifying those coping skills, it's identifying support systems, it's identifying resources and how to set good, healthy boundaries and when they've done it. And, you know, really kind of identifying all those protective factors that have been discussed throughout the process of treatment. It is also talking about how to access them. And I think that's something that we have to be thoughtful of as well. It's great to be able to identify resources. It's also real important to be able to know how to get to them. So knowing what they are isn't as helpful if you don't know how to get to them and use them. Also within this, we're going to talk about with kids and families and caregivers sort of a plan for how to manage and cope through sort of natural setbacks that can be a part of the termination process. So it's a pretty normal thing for there to be sort of increased behavioral or emotional symptoms around the time of saying goodbye to your therapist. So we really want to work with families to get a good plan together about how they're going to manage that when it happens. Sorry guys, I'm having trouble advancing the slide. We're also going to help the client discuss feelings about ending the relationship. And, you know, this is maybe the hardest of all of them because what this might mean is just bearing witness to pain. Saying goodbye is hard and it's painful. And I think a lot of times we fall into that trap of trying to convince or cognitively coach someone out of feeling discomfort or pain, and it can be really difficult to sit with someone and not try to fix it, especially if you sort of believe that yourself as part of that pain. And so, you know, causing pain to our clients when it's time to say goodbye can be really difficult, and it can be very difficult to just sit with them as they experience it. And yet we're challenged to sort of create that space in which they can do just that. And so sometimes we really have to sort of just bear witness to the pain of saying goodbye. And that can be a really challenging thing for those of us who are clinicians. And, you know, we went into this field to help people heal and to feel better and sort of move through pain. And so it can be really hard to just bear witness to that. And then we would also want to make any referrals as needed. Again, just an important part of the termination process. It can have many different meanings. It may mean other therapy sources. It may be resources for daily living. It could be educational resources. And it could be whatever it is that the family's in need of, and we can make a referral to assist them or help them through the transition. So we've talked about what to do in termination. We've talked about how to plan one. Let's spend a little bit of time on how you know it's time. So in general, we know it's time to terminate when goals and objectives that you co-created with your families have been met, when services are no longer needed or serving the client's interest, and when we see reduced symptomology. And that could come from self-report, it could come from parent report, and it can also come from outcome measures, as well as clinical judgment. I would be willing to bet that most of us make decisions based on good clinical instinct. We probably don't do a whole lot of things just on a whim in our sessions. You know, we have honed a good clinical instinct to know. And so, you know, that clinical gut, when it's starting to tell you that it's time to really start to pay attention to some of the other things to know, as well as seek consultation. And different clinicians tackle this in different ways. Some clinicians may do, I call it the fade out. That's when you maybe are seeing someone every week, and then you go to every other, and then maybe you go to every month. Some clinicians will pick a date and then plan booster sessions, you know, set kind of further apart as they move forward. And some clinicians just set a date, and that is the end of therapy, and that's when they terminate. So I'm going to talk a little bit, well, I'm going to talk specifically about TSCBT termination, and truly the reason why I focused on TSCBT is because it's the one that has the most prevalence in our state at this point. Certainly through ARBEST and our dissemination project, we have other evidence-based treatments out there. However, TSCBT has kind of been around longer, and we have more clinicians trained in that model. So with TSCBT, this slide just sort of has that practice acronym to show you this is what you've already done. So as you've moved through the course of TSCBT, you've done these components, and we're starting then to look at termination. And so other things that we're going to think about, so obviously you've, you know, within TSCBT and thinking about termination, you've completed those components. Also, you're going to look for that reduced symptomology, and this includes the symptomology around the trauma. And so are kiddos able to sort of discuss the trauma and memories of the trauma, trauma reminders, without becoming emotionally and behaviorally dysregulated, and has that improved through the course of treatment from where they started? That can be determined through the use of those outcome measures like the CAT, as well as, there we go, again, parent report, the child's report, as well as your clinical judgment. You're also going to have, within the looking at termination with TSCBT, you will have discussed a plan for maintaining that progress, as well as that contingency plan for, you know, those natural setbacks, and you will have made referrals as needed. So how do you tell the client and the family? Again, you have discussed this since day one. We do not surprise families with goodbyes. Again, this can be, you know, one of the most challenging things we do through the context of our therapeutic relationships with our kids and families. Knowing how to approach a discussion about saying goodbye ahead of time can really make sure that we're able to terminate in that most ethical and most therapeutic way possible. It can also help to alleviate some of the anxiety for us as clinicians. We're going to have a session or sessions to discuss termination and process those fears or worries that they might have about ending therapy. And then within the context of TSCBT, we can even make that part of the trauma narrative or trauma narration and processing component. And so a lot of times kids will choose to make some sort of product of narrative that is like a book or a poem or something like that. And so I like to include these things you see on the slide as part of that narrative. And so, you know, what I worry about when therapy ends, what I've learned in therapy, how therapy has helped me, or the best part of ending therapy. And, you know, something I do want to sort of make sure to point out is when we do that component in TSCBT, we often have a product. And so that might be a book, it might be a poem, it might be a picture. Some of you may have been on some of my consultation calls. I once had interpretive dance in a very small office with a whole lot of people. It is awesome to have those products come from that component. And the work, the actual narrative and processing is the back and forth between you and the kid and the involvement of the caregiver. And so we really need to make sure that within the process of that, we're talking about what it will be like when therapy ends. So some things to know. I'm working on it. There really are things to know. There we go. Some parents don't want to graduate. I'm sure that's not a surprise to most people on the call. There are a few ways to handle this and a few reasons why. So it's best to address, just bring that on into session and talk about it. You know, some caregivers are fearful that at the end of therapy, their kiddo is going to decompensate, that you're going to see a reemergence of those emotional dysregulation or behavior dysregulation that sort of brought them to treatment in the first place. And so, you know, we'll have worked with them to make a plan for those natural setbacks, and we will have discussed and prepared them for that. So, you know, that can really be one of those things that makes it really scary to some caregivers when we talk about termination. They may also be fearful that the kiddo will keep talking about trauma. They might be afraid they will decompensate. We know that through the course of evidence-based treatments for kiddos who've experienced trauma that, you know, often caregivers' own symptomology improves. And so they may be fearful that when they don't see you anymore, they will decompensate. And then again, like we've talked about, emotions around endings are really intense. And it might be too intense. And so they may attempt to control the ending. And sometimes what that looks like is early dropout. Sometimes what that looks like is a lot of cows. And so you may see that parents come in with a lot of stories or maybe even complaints about the kid's behavior or other things that are going on that make them really reticent to terminate therapy. Also, sometimes children don't want to graduate. And so there may be a few reasons for this as well. And again, it's just best to address it and bring it into session and have that discussion. So they may be fearful that they're going to get anxious. And so again, you will have a plan for those natural setbacks, as well as you will have informed them that that's sort of a natural part of termination as well. They may fear that the trauma will happen again. Honestly, guys, they may not want to lose you. You may be one of few, if not the only grown-up in a kid's life who has listened to them and allowed them to sort of have their experience and believe in them and give them effective coping mechanisms. And so it might be really scary for them to not have you as a regular part of their lives anymore. It could also be, again, that emotions are really intense around endings, and, you know, they may attempt to control the ending, and, you know, that, again, may look like a lot of cows. So just something I want you to know is some clients will improve through the course of treatment and just drop out. They sort of naturally attrition themselves. And so often I think we think of early dropout as an indicator of an unsuccessful case. And I don't think that's always necessarily what's happening. Sometimes kids just get better and don't need to come out or come on back into the therapy room. And so we have to really kind of think about that too, especially with those cases that really feel unfinished. It could be that they just got better and they didn't need you anymore. So, saying goodbye. Something I have found in my own practice is that it can really be helpful to have rituals around saying goodbye. And so one of the ways that I have done that is to make it, again, part of that narrative. And we do want to focus on the future while keeping in mind that sometimes we do need to just bear witness. And so It's a little bit of a balancing act, and I really like to incorporate that into the work that we're doing as part of the trauma narration and processing. We also want to have a session to prepare. And what I mean by this is, we've been working with kids and families through the course of their treatment, knowing that, the therapeutic relationship will end. What I like to do is to give a session to plan their graduation session. And so I have time set aside for them to sort of tell me how they want to shape that and what they want it to be like, and involve their caregiver in making it a celebration that's really meaningful to them. We're going to come back to graduation wall. Essentially what that is a way for kids to sort of leave behind something of themselves and the work that they did as part of meaning making for them. Also as a way to inspire and convey hope to families who are just getting started, as well as to have something for me to reference on those days where I have imposter syndrome and I'm just not quite sure what I'm doing. It can be something for me to go back and look at for myself as well. I always try to give families a certificate, just to kind of have something that they can take with them to show the work that they've done and really congratulate them on the progress they've made. We're going to come back to biggest fans as well. I'll explain that a little bit in a minute. And then transitional objects. And so that certificate can be a transitional object for sure. Also with kiddos that are graduating or that I'm saying goodbye to for whatever reason, I try to write them each a little note or a letter just to let them know that, I'm proud of the work that they've done and what I've learned from them and what I've really appreciated about them through the course of their treatment or the course of the time that they had with me. And so it's something for them to hold on to. Other things can be sort of crafts that you've created or draw a picture together or, just whatever it is that's meaningful to a kiddo that can help remind them of you. So this is that wall of graduation. What I did, this was in my old office, I had it on my wall. When we moved buildings, we weren't allowed to hang things up. So I put it in a binder and it's available for when families come in and they're first getting started. And I would just trace the kids' hands and they would put their initials and the date of their graduation. And between the thumbs, they would write their hopes and wishes for the kids who were just getting started. And you can see some of them, one says, "I wish you luck." And so it was just sort of a way for them to convey to those kiddos and families that they, hope for healing for them too. And then at the top, I would have them tell those kiddos and families sort of their words of wisdom. What advice would you give them? And I can see one is, "I've been through trauma too, and I know that it's safe to talk about it. If you talk about it, you will feel better." And so just sort of encouragement and advice to kids and families who were getting started. And then again, that certificate, it's usually something like this. And sort of depending on the relationship you have with caregivers who are involved, and depending on how they would experience getting a certificate, you could even consider, doing something like that for a caregiver, depending. So sometimes I do that as well. And then, that letter I give them. And then this is what I mean by biggest fan. So the clinic where I did my practice, whenever we had a kid graduate therapy, we would send an email the morning of to let folks know when to gather. And we had signs, and now we have pom-poms. And so as families completed their therapy and left the clinic for the last time, they were congratulated on the work they had done, and they got to see all these lovely smiling faces as they left our clinic. And so something I will say is that particularly with TFCBT, when kids would finish that model, so when they would complete and graduate from TFCBT, even when they were going to continue to be seen in our clinic for perhaps a different kind of therapy or maybe medication management, we would go ahead and have a graduation session, and they would be met with biggest fans to sort of landmark the work that they had done with that model. And finally, we're excited. So if you want to dig in a little more about saying goodbye and the ethics of that and the therapeutic implications of that, these are some places to start. And I also cited the NASW Code of Ethics for social workers. And that is the end of the presentation.
All right, thanks, Kelly. So yeah, if you have a question, please type those in. We got a few minutes and we'll get to the CEU slide here. So some questions have trickled in, and one of them is thoughts on, so during maybe the last session or two in termination, providing like boundaries to clients to allow them to like check back in, like what are your thoughts on that, like major milestones, I'm off to college, like what are your kind of thoughts on that, Kelly?
So again, I'm going to defer and reference Code of Ethics. I think that is one of those things that can be nuanced amongst disciplines. What I do in my own practice is if a client or their family wants to reach out to me to sort of check in and let me know how they're doing, or let me know they've graduated high school or something like that, I think that's personally fine. I do, however, from the very beginning, sort of set the expectation of confidentiality. And so I'll let them know that, I can't contact them outside of, sort of the context of that therapeutic relationship. And in fact, I even let them know, if we run into each other at Target, I can't approach you, you would have to approach me and talk first. Because it's, their confidentiality to sort of break. And so I think it's okay for families to sort of let you know how they're doing. I think you have to really consider how that might play out and sort of the implications that might mean. So, those boundaries, you have to kind of consider, again, that differential of power and what that might look like and how that might impact families.
Okay, great. And then another sort of question or advice question is, a therapist is kind of feeling maybe not fully supported in engaging clients with termination. Agency supervisor doesn't really want them to tell them that up front. It's more of kind of like a warm handoff. Kind of what advice would you have for an individual who's kind of in that situation, agency or supervisor is not really supportive of telling clients up front about termination?
So the way I'm interpreting that question is that the clinician is maybe leaving that position, and maybe another therapist is going to kind of take over, and it sounds like maybe a supervisor is encouraging the clinician not to let a family know about the transition to a different therapist. I kind of go back to our ethical code, and particularly with social workers. And again, if you're not a social worker, the person who wrote that in, go to your profession's ethical code. It says, if there is a reasonable expectation that we know there will be a change, so a realistic anticipation of a disruption of services, we're sort of ethically obligated to let them know that's coming. And so I can't tell you from this webinar, you should do this or you should do that. What I can tell you is what our ethical code says, and that I would seek consultation. Whether that's within your agency or outside of your agency, I think that's a discussion that needs to kind of be had with supervisors and agency directors.
Okay, we got a few more questions. I'm going to advance it to the CEU slide, and then we'll take another question or two. So if you're interested in getting a CEU, the code for today's webinar is 2308. Write that down or save it. Shortly after this webinar, I will send an email out to everyone who attended with a link to a survey, and you'll be asked to enter that code. The code again is 2308, and it'll expire in 5 days. So yeah, so I'll jump back to a question here. Another therapist wants to know, client is really adamant about not terminating, suggestions for her on how do you, despite all your discussions, you've done all that stuff, but they still do not want to terminate services with you. Have you ran into that situation, Kelly?
I have. And it's not an easy answer or an easy situation. I think, and again, it's difficult sort of to answer questions because there's a lot of like nuance to it and what ifs, and I kind of can't get I can't get any feedback from folks who are asking questions. And so, I think the first thing that comes to mind is to sort of bring that into session 2. A lot of times I think we as clinicians feel the need to sort of be able to work magic, and we just can't. And so it can be helpful to let our clients and caregivers sort of behind the scenes. And so what that might mean is sort of just bringing it into session. And so, kiddo, we've been working together for a long time, and, it's time to say goodbye, and I can tell you're really reluctant. Let's talk about what's happening. And so, often it's helpful to just sort of let people in on your own process of what's going on. That may not resolve it, but it might be a good place to start.
Okay. Yeah, so again, if folks are watching with a group, the best thing to do is I will send an email to whoever was the person who signed in, and you can just forward that on to your group members, and they can enter the code. And okay, last question here, and we'll end today's webinar. Do you think there's any unique considerations for working with the trauma population, Kelly? What are your thoughts on that? On termination?
And that's a really good question, because my practice is specific to trauma itself. And so most of the families with whom I work have experienced trauma. And I would be willing to bet that for the majority of people on this call, it's surprising when you encounter a kiddo who has not experienced trauma. I think it's much more common and has become much more sort of the expectation that when we meet new kiddos, that they will have had some sort of potentially traumatic event happen. In terms of, do I think kiddos who have experienced trauma sort of have a different set of needs? I think we have to really be considerate of sort of the kinds of traumas that kids and families have experienced. So for instance, if there's been a lot of traumatic grief, saying goodbye is really important. And so we would really want to give that some time and some space. And I think that's true in terms of really kind of all kinds of trauma, even in situations with maybe, for instance, a particular like singular acute trauma. So a kiddo who has been through a tornado, there was still loss and grief most likely associated with that. Whether it was they, lost their belongings, or they lost their home, or maybe their family pet. Like, there's typically with trauma, there is loss. And so when we think about it in those terms, and the fact that we're going to be saying goodbye to them after we've most likely played a really significant role in their healing, yes, I do think that we have to give some special consideration to that.
Okay, well, thank you. And to everyone who joined us, thank you again for attending today's webinar. All right, everyone have a great day. Take care.
Thank you all. Bye.